And thanks for everybody who came to lecture number 3. So I'm Natalie Zelenka. I work on a project called Data Hazards, and I was also at the University of Bristol doing the job which I just left and he was about to start, where I was a data science specialist. But now, from about 4 weeks ago, I'm now doing exclusively health data science work and kind of getting into the world of electronic health records. But this is really a talk that's more about kind of ethics and data science, and even though we are data scientists and not ethics experts, we think that that's something that is good for everybody to be thinking about. And Huw, do you want to introduce yourself?
Yeah, my name is Huw. I'm finishing my maths PhD at the University of Bristol, and I'm an incoming data scientist at Bristol.
Cool. All right, so like I said, we are data scientists. We do analyze data. We like data science, and we think it's something that we can't afford not to use. And these are some examples that I always use for things that are good. So, for example, finding potholes from the sky instead of driving around to look for them, diagnosing diabetic retinopathy from biomarkers in the eye, or reducing cooling bills by 30% and therefore electricity usage as well. But there's also a lot of things that can go wrong, and we have to acknowledge that. So these are all kind of examples of big kind of things in the news that have gone wrong. So, for example, Twitter's image cropping algorithm. If you put a white and a black face in any order, even though Obama is much more important than Mitch McConnell, you will get Mitch McConnell's face if it's white. And they have all the staff now, and instead of having a data science solution here, they just choose where you actually want to crop the image, like a simpler solution is sometimes better. The second one is the first fatality due to self-driving cars. And the third one is the post office scandal, where an algorithm was used to try and detect fraud, and they falsely accused people of stealing. And someone sadly killed themselves because of this, because they were kind of, publicly shamed for stealing from their job, where they were not doing that at all. So the take-home message of this slide is we can't afford not to use data science. It's really good, but we have to make sure we mitigate harms. And I'm sure in healthcare we can see where that could go wrong. But now I'm going to say a little bit more about how this relates to where we're from, which is research. But I think there's also a very similar argument that can be made for analysis in general. So it kind of starts when you have a cool idea of analysis to do. Then you collect or you access your data somehow. So quite often for researchers, it's through something like UK Biobank, which has already kind of done the NHS improvements behind the scenes. You generate your finding, like, yeah, my method's so accurate. You publish that. Maybe you might even patent it and sell that. You might release your software on GitHub, all good stuff to do, and then it gives you an idea for another cool thing to do. And if you're lucky, there's like some downstream impact. So there might be a spin-out company where the patent might get used, if you're lucky. And the only time that this really gets any ethical oversight in the university setting is when you're applying for the data. You go through an institutional review board and you say, I really want to do this. And they say, okay, if you promise not to give away the patient's data or use it for the wrong things, and they've agreed that you can have their data, and that's cool. And just to give you an example of where that can go wrong, in my PhD, my research was about building something that predicts phenotype from genotype. And I made a slight improvement over existing methods. It was patented, it was sold to a company, which was used, and might even still be being used, for all I know. And the only part of that that was given any ethical oversight was whether or not using the patient data to validate it was something they'd agreed to, and of course they had. But that doesn't mean it's necessarily a good idea to put on the internet an algorithm that can predict somebody's intelligence from their genotype, or one of the many other phenotype codes that exist in human phenotype ontology. And so as I got to the end of my PhD, I was thinking, doing good research that actually helps people, which is obviously what I wanted to do, doesn't just happen by accident, by like following the path of like how to do good research that already exists. And I think that's also true for healthcare analysis. So where was I looking for inspiration? Because it's not only these who are thinking about this stuff, there's like so much inspiration you can draw from other people, patients, sociologists, philosophers, all kinds of great work that goes on. And some of this can be actually quite hard to read on your own if you're an analyst. There's words like reflexivity that made me like, I didn't really know what that was. We set up something called Data Ethics Club. It's a journal club about data science and ethics. Anybody can attend. We do have some attendees who work in the NHS. And it's basically just a kind of interdisciplinary group of people who can help you to talk through these issues with. They're also just getting a really good laugh, which is why we do it. We run it every 2 weeks during term time. So we'll start again in September. Then there's this other class of things, which are kind of like these like checklists and these sort of like ethics frameworks. But a lot of them I find are like very focused on what you as an individual can think about. So it's like still very much like on your own thinking, oh, does this apply to me? And I think it's very easy to convince yourself that it doesn't apply to you because that would be much less work. And so that's the reason that we created Data Hazards. So Data Hazard is a project that basically aims to make it easier to facilitate interdisciplinary conversations around data science and ethics. And to help you as an analyst to be able to identify and mitigate hazards that might exist in your work. And these are supposed to be more broad than things that maybe we understand a bit better, like consent and privacy, although it does include that. But things like, for example, the environmental impact of running these huge machine learning implementations, or the societal impact of creating something that works a lot better for white people than it does for black people, or a lot better for whichever group is better represented in your data. So perhaps people who are more likely to survive versus more likely to die. So that is the kind of big aim of the project. It aims to do that through a shared vocabulary of community-generated data hazard labels. And what that means is we ask people what are they worried about when it comes to data, and this includes analysts and machine learning engineers and philosophers and people who are affected by the things that software engineers are building, and scrutineers, as much of an interdisciplinary group of people you can get together. And we sort those suggestions into hazard labels, which are kind of lay descriptions of some of these issues. There are 12 of them. They are all on our website at datahazards.com. And it's an open source project, so everything is on GitHub. Anybody can suggest new hazards that we haven't thought of, or different ways of describing them if they're not easy to use, or different ways of using them. So these are 10 of the 11 hazard labels. There's just 10 of them there because that tessellated more nicely. Each hazard label has a title, an image showing nicely designed by our animator, a description, which is kind of the longer description of what it means, but also some like real life examples about what projects this could apply to. And all of that is basically supposed to help you think, could this apply to my project? Or could this apply to someone else's project that I'm getting some feedback on? And then really the most important point is the safety precautions, because these tell you how you might be able to mitigate some of these things after you've identified them. So yeah, as I said, there's kind of like a wide variety of things. This one with like a hammer, hammering a screw is dangerous misuse. So for example, if you put something on GitHub, what might that be used for? Could be used by anybody. This one here is classifying and ranking people. And this one here is like community involvement. So are you creating something that actually the community is for wouldn't particularly like? These are sort of things that I think maybe don't get thought of as much in the process of coming up with a cool idea or kind of cost saving measure when we do some analysis. I think now I'm coming over to Huw, and he's going to tell you about a kind of case study of a project that this applies to.
Cool. Am I miking up as well, or am I just gonna?
Yeah, you want to do. I think it's better accessibility wise.
Cool. Whilst I'm being mic'd up, can I have a show of hands? Who's heard of news before? All right, that'll do. Okay, so news stands for. Sorry, I'm loud. Normal. Someone needs to be mic'd up as well. So news stands for National Early Warning Support, and so basically I did a 3-month placement with the Bristol University Digital Health Group, who are working in conjunction with Bristol NHS clinicians, looking at news scores. So news scores is essentially a way of assigning some kind of numerical value to how healthy patients are, like ICU and stuff like that. And so the way you think of it, if you're statistically inclined, is like a general linear model, but the weights are sort of decided by very well-informed clinical opinion. And so the whole point of the project was NHS clinicians coming to the researchers who were with me and saying there are sometimes we've noticed times where news hasn't done done its job as well as we could have hoped. And so the whole point of the project was essentially, can we stress test this news score using clinical data and see where does it fall short? Okay. Oh, that one. Okay, so the project outline is essentially, as I was saying, we're trying to stress test this scoring system. So we were given access to the anonymized medical data from both the NHS, from hospitals in Bristol, and also a data set from MEMIC4, which is an MIT curated data set from the US. You can do lots of different sort of data science type things in there. Two interesting things we did some supervised classification to essentially see, can you predict certain outcomes? For example, if a patient's ready for discharge or not, based on their sort of last readings of their like news score. Or instead of just the score, the variables that go into calculating it, things like oxygen saturation, temperature, stuff like that. But you can also do clustering, where you try and sort of see, just looking at the variables that are used to calculate news, will that sort of sort patients into clinical subtypes, different ICD-10 codes, for example? And so what was interesting for me whilst I was working on this project is at the same time, Natalie and Nina ran a data hazards stall at AI UK a few months ago. And so they invited me to come along with some people to use to create a poster, you see on the right hand side there, of a case study, and then getting people to assign what data hazards they thought corresponded to the project. And it wasn't a competition, but I did win. And so on the right hand side here, you can see kind of zoom in and enhance. But essentially, it was really, I wrote a poster that was, you know, obviously it's a snapshot of what I'm doing. And in particular, I made a point of not trying to reassure anyone's concerns in the poster and instead relied on doing that in person. And that would get me some more figures. And so usually in a kind of data hazard workshop, someone would bring a project along and say, okay, this is the project I'm doing, and I'd like some feedback on what kind of data hazards people here think applies. And in that workshop, people will have more time to kind of learn about what the different data hazards were. In this context, you know, you can see there's stickers and cards and stuff, but some people will just walk over and be like, that may cause direct harm, and then just walk off into the contents. So the result might be hard to see, but it's an interesting thing to kind of motivate you to think about what kind of hazards might apply to a project. Okay, so how can we mitigate these hazards? So under the Zoom banner. So two of the main hazards we're looking at may cause direct harm. We're working in healthcare applications. That's kind of a given, and obviously the whole point of these these warning labels is not, oh, well, this label applies, therefore don't do the project. It's this label applies, therefore you should strongly consider like what can you do to mitigate this issue. So it's really important that we're really rigorously checking our code before we go like, oh yeah, just discharge all these people, it will be fine. I actually trained a classifier that was trying to guess if people were ready for discharge. And one time it just said, well, on average, they are ready for discharge if you look at their last reading. Maybe like 70% of patients were discharged from a data set. So it just said, discharge everyone. What's the worst that could happen? And obviously, like if you think about it for less than a second, you realize it could go wrong. And then also there's the idea of informed consent, which Natalie mentioned earlier. So funnily enough, I was on a project for 3 months, which is about the same amount of time as it takes to get an NHS contract, which you need to access the data, which is why I was working with the MIT data set instead, because I didn't have time to get access. But before I used that data set, I had to go through some medical confidentiality training. The other kind of hazards that are sort of quite evident is the concerns from people were, what about automating decisions? And so the whole point of news, for those of you who sort of worked with it before, is it's not there to tell doctors what to do. It's sort of to help give them a nudge and be like, this person's news score's just gone up, which suggests their health might have deteriorated. Go and have a look. One of the speakers earlier said something about like a smoke signal, which I really liked as a sort of analogy for that. And then also this idea of like ranking or classifying. We know there are some inequalities in the way that healthcare is delivered to different groups. And so it's important that we don't reinforce those things. But it's important to acknowledge that just because there's a different amount of healthcare, it's also about what needs different patients have, right? So a really healthy patient with a very low news score might be ready to be discharged. And it's important to acknowledge that that's beneficial to the system to actually get us another bed and to get that patient out and about. But yeah, so that's sort of an example of how you could apply data hazards with crowdfunding. Yeah, possible, definitely.
Thank you. Thanks. Sorry for my first. Okay. And so this is a kind of a more general way of how the hazard labels are applied and used by people. So this is a cool cartoon that we have got done recently as we're kind of trying to write up a more detailed account of how to use this stuff for the Turing way, which I really recommend the Turing way. It's an online handbook for data science and it covers a lot of different things. But essentially, we have this acronym, I guess, LARD, easy to remember, this is why I like it, where you can learn about, you can consider it hazards to learn about ethics, learn about different ethical issues in general. We have 3 explainer videos on our website. They're very nicely animated, friendly introduction to this stuff, and quite funny as well, I think. We also give talks about them where we go through them a little bit more in detail. We run workshops where people can apply the data hazard labels to their projects. We've done train the trainer courses for these. So we have a kind of variety of people kind of spread around the UK who can run these workshops. So if you are interested in having one of those run in your team, please do get in touch. They look like usually 1, 2, or 3 projects. You give a kind of short description of what they're working on, and then we kind of try to invite as interdisciplinary a group of people as we can to think about what might apply and why. After you've applied them, you can display them in different ways. Firstly, you can do a kind of ethics pre-registration using the Open Science Framework if you're familiar with that, which basically means thinking about some of these issues in advance and maybe picking a couple of mitigations that might be beneficial for you and your project. Maybe implementing some testing or some continuous integration might be something that you want to do. I think everyone would agree that it's impossible to do everything. I think this project for me is about making kind of like an incremental, like cultural change in what we consider to be part of data science and doing ethics in that. And they're also quite fun to display like on talks, just like as a talking point. But really the biggest point is to kind of reflect on this, think about what mitigations you could choose. And that happens like the whole way through a data project's life cycle. We have two papers you can read. This one here is a preprint at the moment. It's on the Open Science Framework preprint. It's basically all about how the labels were developed, and also it has two case studies. One about NHS data project, data linkage project, and then the one about horse racing analysis project, kind of veterinary medicine, I guess. And then we also have a paper about data ethics club, which is our leading group for data ethics and data science. So if you'd like to read or cite either of those, please do. We've got a lot of big plans for what to do next, sharing the project more widely. We've got a lot of thoughts about how to improve the labels, to make it more ontology-like, to have slims that maybe apply specifically to different areas. I would love to develop a healthcare analytics set of labels that work specifically in that context. And just generally improving them, making them more accessible and easy to use. For example, having an app to download with images, which is images apply to kind of easily stick onto a poster, for example, or interfacing with other tools like the OSF more seamlessly. And finally, we'd love to create links between other kind of taxonomies of risk, so that as well as being this kind of bottom-up description of how we can talk together about ethics, it also links to kind of more academic understandings of what some of these issues are. And it's all GitHub, and we'd love your help with any of these things. So if you search data hazards, you'll be able to find it, and there's a link on our website, of course. I'd really like to thank all of the people who contributed to the workshop and the materials that are there at the moment, also to our participants who aren't included here because we didn't have their consent to put their photos here, but also to them. And I'd like to especially give a shout out to Nina, who kind of co-leads this project with me but couldn't make it today. Please do get in touch if you're interested in any of these things, and datahazards.com is the place where all of the information is about this. Thank you.
Thank you both very much. It's really, really interesting stuff. Anyone got questions or points they want to raise from some of the presentations?
I think that's really interesting. Have you spent time thinking about the public brand programmer-led bias and having one of the ways that mitigate?
So we have one hazard which is called reinforcing existing bias. And I guess it's a little bit, all of the labels are quite broad. I guess because they were first created for these interdisciplinary conversations, so we didn't want like a giant number of them to begin with. But in terms of the bias of choosing what to put into the models and that kind of thing. Yeah, so we do have like various safety precautions for that particular label. So that might include things like testing your algorithm for different groups specifically and reporting on how well it works for them. It might include things like generating, changing the data so that you're like upsampling groups that are not well represented in the data, or choosing a method that works better for that. But if there is any additional ones, then we'd love to add those in.
Great, thank you. So, another question, Gareth.
Yeah, excellent work. When it comes to applying it in like public sector or industry, one of the hard things is kind of senior management buy-in or kind of them getting involved in this, you know, the data scientists, etc. You see a lot of activity and engagement there. And is there any material, have you got anything focused around more of that, how to persuade or encourage the more?
Yes. Yeah, it's a really cool idea. I guess the route I've really taken so far is to try to build in engagement at places where I can affect the system. So for example, when I used to work at the Gene Golding Institute, we gave out some funding for data science projects, and we would say, we'd like you to do some kind of like ethics pre-registration. We'll run this workshop if you want to come. Would you be willing to do that? And we didn't like force it, but when people are applying for stuff, they will like say yes. A similar place that I think is a similar thing will be introduced is at UCL. They have kind of high performance computing, and to access the GPUs, this is like another great time to be like, maybe you should. So that's how I kind of got around it so far. And yeah, I've found that the most senior people are also the most difficult to persuade. And I kind of have gone for making it optional and getting somebody in their team to say they'd like to do it. Yeah, I kind of think of it similar to like open research, where I don't think you want to be like too like judgmental or prescriptive. I don't think that's very persuasive. So I've kind of gone for a gentler route so far. But I think it would be cool to have some materials like specifically aimed at that group.
Yes.
Yeah, so if I understand it correctly, this is a lot around the development of the model and the intervention, as it were, that's around that solution. Do you see this potentially being used in an ongoing way while it's actually in use, Mario?
Yeah, so there's kind of quite a big selection of safety precautions. They could be stuff like having focus groups, so it could be stuff that's like much more to do with like testing and continuous integration. Like there's really like a wide range of things that people have suggested. But what I really want to do is to have a kind of, because one good way of persuading more technical people I found is like GitHub badges. Like they have a GitHub badge, like I have one too, I'm not gonna lie. But I was thinking it would be really cool to have them like time out after 6 months if you don't redo some of the parts that would make sense to redo. So I guess like with data drift, you might imagine that like your model stops working as well for certain groups. And I think there's certain things that would make sense to do, I don't know, every time you push an update, or you know, every X amount of time. And I think it depends on what the intervention is, how often that needs repeating.